Coming up in this episode.
One thing that struck me was the pain, the body aches, and I know that's not coming in lightly from someone who is a former UK Ironman champion. Triathlons are some of the most painful endurance events. How does COVID compare? I'm sure you've had colds and flus in the past. How much more painful was this than some of the other experiences that you've had in your life, whether on the athletic side or on the illness side?
How does the pain that I experienced compare to that? It was a very different kind of pain. It was very much in the insertions in my hips and in my lower back. I kind of it's kind of akin to what I think that it would like a rheumatoid arthritis would feel like, where the actual just the total like inflammation, like hot pain, as it were.
Yeah.
Welcome to the HVMN podcast. What we do with our bodies today becomes the foundation of who we are tomorrow. This is Health via Modern Nutrition.
This is your host, Geoffrey Woo, and I'm really excited to be joined by Dr. Tamsin Lewis. What a crazy last few months. The last time Tam and I were hanging out, we were at the gym, doing a swim, doing a hot sauna, and fast forward a couple months, we're at the start of April now, and a lot has happened in the world, and a lot has happened, I'm sure, in your neck of the woods. Tam, how are you doing?
It's been a very difficult time on multiple levels, but yeah, it's good to check in, and hopefully the information that we talk about is going to be relevant to people, and they can take something from it without feeling the anxiety that a lot of us have been feeling about what's going on in the world right now.
Yeah, no, 100%. I think we've been talking offline over the last few weeks, and I would say that you're one of the doctors, especially out of United Kingdom, who is starting to take the COVID-19 very, very seriously. I know that over the last couple months, it went from something that was very foreign, something that didn't seem that was going to necessarily impact our daily lives, where the advice from the health authorities was, do business as usual, keep going to restaurants, keep doing your life. And I think some of the early rumblings were, hey, we should be treating this much more seriously. And that was an interesting insight from your part, being an early vocal person about that on social media. But then you had a personal, very visceral, and still ongoing experience with COVID-19 personally. Love to just get the deep dive there. Where's your head at now?
I had the energy to go back on social media this week and share some of my experiences, but for nearly 2 weeks, when I was in the depths of it, I really didn't have the energy to really outside the people that I'm close to talk about it. So when we last spoke, like I say, I was having advice and information from people at various levels and medical and also government that we should potentially be a bit more concerned about this virus than a lot of people were. So I actually restricted my time going into town quite early on, but I think it was a bit too late for me. I came across probably 3 or 4 different people who now, in hindsight, were diagnosed, sort of with time retrospectively, were diagnosed with COVID or what looked like COVID. And so I myself came down with what did turn out to be diagnosed. And yes, I was lucky enough to get a test as a health professional. I was diagnosed with COVID-19 on 27th of March, I think it was, but my first symptoms started on the 14th of March. And I remember it quite vividly. I had dinner with a friend and started to feel my heart rate. I'm going to preempt all of this by saying I am hugely self-aware, and I think that comes from my background as an athlete and also as a doctor, and also the fact I wear like a million wearables and have done. So I'm very conscious of subtle changes in my body. So I was having dinner and I got home and my heart rate, I could just feel my heart in my chest a bit higher than normal. Started to feel a bit shivery, had sort of like abdominal pain in the right of my stomach. And I thought I was ovulating, which was a bit strange. But, some women do have ovulation pain in the middle of the month, and I do occasionally. Anyway, went to bed and was very hot that night. Had my Oura Ring on, as I said, and I woke up in the night, and I do wake up, a couple of times in the night, go to the bathroom. I was so weak. I felt like my body had just been like engrossed with this heat and feeling of fatigue, and it was tiring to pick up the cup in the night to have a sip of water. Anyway, woke up in the morning, my Oura Ring score was like 48, which has only ever happened before when I've had a terrible hangover and negated on sleep. So, and it said your body temperature is raised, your heart rate is 15, if not more, above average. I think it was 15 or 17 above average. My respiratory rate was increased, and it basically said to me, you're not well. I felt pretty horrible, but I didn't feel like I did in the night. I kind of got up, I could go about my daily activities. I took a blood test myself, because that's kind of what I do occasionally, because I'm obsessed with biomarkers and data. I also wanted to check whether, what this pain in my stomach was, if there was any infection, if my estrogen level was through the roof and it was an ovulation or a cyst or something like that. So I did a blood test. I also started on Tamiflu, because back on the 14th of March, there was some evidence that Tamiflu potentially could help early stages of the illness. And I think it did do something. I don't know quite what, but I do know quite what, but we can't measure it. It definitely decreased my temperature. So the next night I had a temperature of a very slight increase of 1.1 Fahrenheit, as opposed to the first night when Aura recorded it as plus 3.3. So I felt slightly better. So what it did is kind of lift my energy. Like, I felt quite agitated, anxious, definitely not tired. I had like sweaty palms, sweaty underpits, and I was still working, and remotely I was dealing with a lot of client inquiries, etc., logistics. So that, if you can think, that was the first few days. The blood test came back the same day, and it showed a reduced lymphocyte count. And lymphocyte is a type of white blood cell. Now, lymphocytes specifically, a decrease in lymphocyte count has been associated with, or is associated with, viral illness. And we know that in COVID-19, the lymphocyte count decreases. So that was kind of a red flag. I also had an ALT, which is one of the liver enzymes, and that was up, as was my LDH, all signs of an infection. Now, still, even at that time, I kind of didn't want to believe I had COVID. I thought, look, it could be anything. It could just be a flu. I should preempt this by saying in January, I came back from Thailand, sort of January the 10th, and I had similar symptoms then, with like slightly tight chest around my trachea, the central portion. Felt very tired. I did not have a fever. Now, I do not know, and I'm thinking about this on reflection and having talked to a number of medical professionals, that perhaps I had an early insult of COVID when I was in Thailand, and then had an additional insult from a different strain when I was in London. That could potentially explain why I was hit so bad. Anyway, to continue with the story, if you can imagine, so the Tamiflu I took for 3 days. I think it made me feel quite sort of agitated and quite activated. And I don't know if it had an effect on the virus load, but I kind of felt okay. I decided at that point that I would still not thinking it was COVID-19. I was thinking, look, I just want to get out of London before, a few people that in the know were saying we're going to get shut down. I wanted to get out of London, being in my family, if anything went wrong. So I basically got in the car with my daughter and my au pair and drove to Devon, which is in the country, 3 hours out of London. Once I was in the country, I basically isolated in a house, because I thought at that time maybe it could be this. I started to develop tight chest, very wheezy, very tight, and then a little bit of sputum production, cough in the back of my throat. I called NHS 111, which is essentially what everyone is being told to do in the UK. It's kind of like a central point of contact. They are overwhelmed. They told me that I just needed to rest, and that if I had access to something to measure my blood oxygen saturations, that would be helpful. I ordered something on Amazon and I got it. I started to take an antibiotic, which I had prescribed by a private practitioner of mine because I felt that I potentially had a chest infection. We weren't quite sure it was COVID at this point. So I started taking azithromycin. I think the chest symptoms got a little bit better. Then on day 7, I literally developed this agonizing pain in my body, specifically in my hip flexors and my lower back, like my SI joint, and I felt like my body was on fire, which was actually the point where I started to get really worried. I was kind of on my own with my 5-year-old and a young au pair who was isolated from her family. I called a few doctors, including the NHS 111, and they said, look, if you have shortness of breath or any worsening of breath, then you need to go to A&E. And at that point, it was touch and go whether I did. I ended up just getting a heavy painkiller prescribed to help deal with the pain, and I'm not joking, it was worse than any pain I've experienced in any Ironman event. And I also had this anti-malarial drug, hydroxychloroquine, which has been shown, obviously your president has talked endlessly about it being a miracle. It is not a miracle, although it does seem to have some efficacy if used early on in the illness against replication of the virus and particularly development of chest symptoms. So I started taking that and it did help my chest symptoms without a doubt, but I became very weak. And I don't know if the two were correlated. I seem to think it made me a bit weaker. So I started that, the antibiotic, and then I had this hiatus where chest seemed to improve, energy seemed to improve from sort of day 9 to 14, and I was doing a little bit more every day, going for walks, a little bit longer walks, doing a bit of yoga, and then the longer walk where I literally feel like an idiot saying this because it's my mindset. I tried a little run up one of the hills, and I had this pain in my chest, like this quite severe pain in my chest, which literally took me aback, even though my energy felt okay on that day. And my knees, both of them kind of swelled up, both signs of general inflammation. I've not had that. And I got home, I started to shiver, and then I basically had to get into bed. And I got a fever again overnight, lots of cold sweats, and felt absolutely exhausted. So it was almost like something had been re-triggered, like the virus was just like reactivated, and it was at a low level. I think also what happened is I probably, did a bit too much too soon, both with the exercise and through other aspects of my life, thinking I was a bit better. Developed like a head cold, like I got this kind of sinus infection. And I'm not prone to sinus infections, and my sinuses like swelled up. They were painful to touch. All these strange things happening, and I think it's a sign essentially of a dysregulated immune system. We haven't quite worked out why my immune system has become so dysregulated, but obviously I'm coming out the other side of it now. I'm day 19 today as we speak, and have been doing very little because it definitely scared me to be knocked on my back and having to stay in bed for pretty much 48 hours, apart from to get up and eat soup and some collagen decaf coffee with coconut cream. So my story here is, just to try and say to people that, there's a lot of sort of contempt for the rules and for this social isolation early on, and people were saying that only we've just got to protect the old and the sick, and then stories started to come out that actually there were triathletes were getting affected by this. A friend of a friend, literally his 55-year-old fit triathlete friend who was in Mount Sinai died, and he had no pre-existing conditions, nothing. So what I'm trying to say is that we need to have a little bit of caution around this illness, that we need to take symptoms seriously. We need to monitor symptoms, and we need to, ask for help, or when, early on in the illness, because by the time people are getting admitted to hospital, that's when it can be a little bit too late. And there's a lot we can potentially do in the early stages of illness. The biggest one is like rest, staying away from other people, not, looking at what you're eating, drinking, avoiding stimulants, and really sort of reaching out to your practitioner, and getting advice. Do you need to start on an antiviral? Do you need to start on an antibiotic? Do you have a device that can measure your home oxygen saturations? All of the above, because home care is essential here. And part of what I've been doing in my work is trying to enable people to care for themselves at home. Worst case scenario, that they don't get into hospitals. Like I said, for me, when I got this, it was relatively early on in the pandemic in London. There's, it's pretty much, we are going essentially nearly the way of Italy, and we've really got to look at how to backpedal here. And my experience has been quite frightening. And one of the things that has helped me.
Yeah. I mean, we have 1 million cases globally now, and approximately 1,000 folks in America are dying per day, and we're still on that ramp up exponential curve. I mean, I think, again, just from a personally and from an audience perspective, thank you so much for taking the time to share your story, because I think people are scared. People don't really have good access to information. But I think your background as a medical doctor, your background as a world-class athlete who had, my understanding, no comorbidities, very healthy, very fit, and just checking in with really detailed information of symptoms, your responses, kind of your protocol, I think is a really useful template, because I don't think people have the opportunity to have a long form discussion on what this kind of looks like. And I think this snapshot, this N=1, from someone who has that medical background, that has experience treating patients across a number of diseases, I think is very, very valuable. Not to say that this is medical advice for the general public, but just this case study of yourself is informative for folks that might have to make decisions on how they best take care of themselves.
No, for sure. I think sharing some of the things that I have felt helpful, and sharing some of the side effects of things that I potentially haven't been helpful. For example, my experience with Tamiflu, I think probably it was the wrong decision in retrospect. And the advice I've been given from ITU, intensive ICU, you call it, consultant since, is that it probably doesn't help, and it can even suppress your initial immune system response, which is, I think, what happened, which is why I had one fever, and then I took the Tamiflu and I didn't get a fever. So that impacting of my initial immune response might have actually been of detriment. So that's one thing I've learned. Since secondary, I've learned that acetaminophen, as you call it, paracetamol in the UK, was definitely not strong enough for some of the pain relief. We know that we shouldn't use non-steroidal anti-inflammatories like Nurofen, I don't know what you call it, Voltarol, Voltaren, diclofenac, any of those
Tylenol.
things. Looking after your immune system response is key. Anyone with asthma or any other lung condition, COPD, CF, obviously those vulnerable individuals need to reach out to their primary care providers fairly soon on in any symptoms, because I have learned that there's a lot of people calling me going, oh, I've just got a cough, I just feel a little bit tired. I'm like, this illness affects people so differently at different times. It has a long course trajectory. For example, I thought I was over it at sort of day 9, and then, you go downhill again. So I think it's being prepared that you have to be in this for the long haul. And having that patience in today's society is really difficult, we think we're doing all the right things, but actually, taking time out, resting. And rest means not being on, and I learned this as well, not being on 1,700 phone calls to different people who are taking, from your energy or wanting something, because even if you're not moving, that's still, energy. So, listen, like a general cough, malaise may develop into a more severe form of COVID-19, or it may not. Your husband, your wife, your child, everyone seems to be affected differently by this illness, and we don't seem to really be able to predict, other than people that have huge comorbidities, who it's going to affect. So just be mindful of the different symptoms. Try not to worry about their progression, but accept the progression and, reach out for help. And when I say progression of symptoms, I mean development of chest pain, development of severe joint and muscle aches. There was an article published today in one of the British broadsheets, which is based on some research data that's done on blood biomarkers and radiography. So it's saying that if you develop severe joint aches or muscle pains relatively early on in the illness, that's more likely to be a prognostic indicator of a more severe form of the illness, and therefore people like that should be monitored more closely. As I remember saying to you earlier when we've been speaking today, when I developed that on day 7, it was pretty frightening because I literally felt like I said, my pelvis and hips were on fire. And so for whatever reason, I have a particular virulent form of the illness. I also had the biomarker ALT, as I said, that was raised, the low lymphocytes. All of those are indicators of more severe infection. Now, why I had that, we don't know. As I've said, it might be that it's, in my history as an endurance athlete, means I run, high glucocorticoid levels. I'm almost like, got a little bit of cortisol resistance in that sense because it's what my body's used to. And I'm a type A. I push myself hard in most aspects of life. And that can be immunosuppressive. You can take as many million supplements as you want. You can eat keto, you can eat clean. But if you neglect the basics on stress and stress management, sleep, community, passion, all of those things, then, there is this aspect of dysregulation in the immune system, which means it's overreacting or underreacting in some capacity.
Yeah, I think it is an interesting point. I might have misspoken. I want to correct myself, not put misinformation out there. Tylenol is a non-steroidal anti-inflammatory drug, and I know that there's been some early literature to avoid NSAIDs and go for other types of painkillers or fever suppressants. But I think this is just definitely very fast moving. So again, I think Tamiflu, which might be good for anti-inflammatories for something like the flu, might not necessarily transfer or be beneficial for COVID, which just seems like it replicates from your experience.
Tamiflu, we should probably rectify it. Tamiflu is a licensed medication for the treatment of influenza, which is a virus. So the whole concept here is that there is crossover of antiviral killing activity, for want of a better term. So that initially we thought that Tamiflu could, actually have direct antiviral activity. We know that either the coronavirus is clever and outwits it, and the Tamiflu can have a direct effect on the immune system aside from that. So the other kinds of drugs that have been used and are being trialed, and people are asking about, are the HIV drugs, like lopinavir, ritonavir, all of these kind of drugs that prevent the reactivation of the virus of HIV. So they're used for what they call post-exposure prophylaxis. So if you've been in contact with someone who has HIV, for example, or they are drugs that are used to treat HIV infection to reduce the effective viral load. Because what happens in this illness, and these drugs are being used in hospitals around the world. I have not taken any. I've had advice that maybe, if this virus continued to progress on the chest, that it's something that I could use, but I have not personally used them. So reducing the viral load in the body is important. As I mentioned before, what seems to happen is your immune system activates, gets the viral load down, and then if you potentially do too much, your immune system in its suppressed state gets another infection like a sinus infection or just a common cold, and then the immune cascade, so your immune system response goes crazy. That can also cause what they think is inflammation in the lungs as well. So yeah, it's being very mindful of your behavior, I think.
Yeah, and I think you just mentioned like the cytokine storm, where it's either your immune system is so suppressed where it can't fight back, or there's other symptoms or other presentations of the disease where you have a cytokine storm. you have an overreaction of your immune system, and that causes acute respiratory distress syndrome. So it is this fine balance of what one can do through their sleep, rest, diet, nutrition, and then what can one do with pharmaceuticals or drugs or more of these kind of medical interventions. And I think the protocols are still being defined. You mentioned using hydroxychloroquine, which, as you mentioned, Donald Trump was hyping up potentially prematurely, where some of the folks at CDC have walked that back a little bit. But there are ongoing trials. It is being used off label in a number of different hospital systems today. Obviously, it's designed as an anti-malaria drug, and there are fairly serious side effects with hydroxychloroquine. So it's not something you necessarily take lightly, but it'd be helpful to get your personal thoughts on how that drug was beneficial for you. What were the side effects? How did it net out for you?
Listen, I've been in touch with a lot of the research around hydroxychloroquine and actually had some. We ordered some probably 6 weeks ago now because we were looking at early study data before the French trial came out. I don't think we know yet who it's beneficial for in particular. I think from what I've heard and from what I know is that it partitions as a drug. And what I mean is that some of the drug in itself kind of stains the lungs, for want of a better word, and as it stains the lungs, that kind of has a direct antivirus activity. So people that die of this illness tend to get what they call acute respiratory distress syndrome, ARDS, which then descends into pneumonia, secondary bacterial infection, and that's when it all goes wrong. This drug seems to, as I said, by its effect directly on the lungs, stop the viral replication in the lungs. Now, the point at which is best to take it is of dispute. Some doctors are saying you should take it at the first sign of a cough or any fever or any symptoms whatsoever. Some people are saying, going even further, to say that you should take a prophylactic dose, which is like a once to twice weekly dose of it to stop to kind of like load up your lung tissue so that the virus it's not attractive to the lung virus. It can't take hold. My experience with it personally is that, and I was convinced by probably 4 different doctor friends to take it because I'm young, fit, healthy, apparently 40. I don't feel that young or fit anymore. But as normative scales go, I'm relatively healthy, being a former Ironman athlete, etc. The warning point for me was that I developed this chest pain, this tightness of chest and this chest pain. I mean, I'm telling you, I was short of breath walking up a few flights of, a few stairs and having a shower. It felt suffocating, and I have never had that in my life. So I did have some evidence that I had this cytokine storm potentially beginning in my lungs, and that tightness of the chest, the pain, I could literally feel it I could still feel it at times. It's in my specifically in the right upper lobe of my lung. When I took the hydroxychloroquine the first time, I took it on day 7 when I spoke to a doctor, and I took it alongside the azithromycin, which was what was used in the French trial. It definitely seemed to help my chest symptoms. It definitely seemed to make my chest less tight, less wheezy. But as I said earlier, I feel like it made my muscle aches and fatigue and weakness worse. I also think it played a bit with my blood sugar levels. And that's what it can do as well. So if you're like me, prone to liking keto, specifically in the day, or more like low carb, I felt a bit wobbly, as it were. I took it for 2 days and then I stopped, and that was correlated with me having that sort of break when I felt better, then taking it too far, doing too much. I restarted it on day 15, which was 3 days ago now. I took it for 2 days, 200 milligrams twice a day, with again the azithromycin. Felt very wiped out, but my chest did improve. I decided today not to take it anymore, which is probably because of the side effects. Like I developed this whirring pain in my ear, and it would literally kind of keep me awake a bit. It was quite scary actually. But people have said to me, look, you can cope with side effects. The problem here is your lungs. You need to protect your lungs, and this drug is protecting your lungs, but it has, it's not a paracetamol. It's not acetaminophen. It does have side effects in some people. So, yes, I have to just caution people, because we've all read the stories of people taking, Trump's advice and then drinking fish tank cleaner, which contains chloroquine. I mean, come on, guys, you've got to have. This is a drug. It's a medicine. It should be. Should have some medical guidance around it. But it seems to have a lot of promising evidence, a lot of promising data. But I think if you have access to it and that you are potentially at risk from a more severe form of this illness, then starting it earlier rather than later is a good idea. The other things that are helpful, as I said, are steam showers. You've probably seen Ben Greenfield, who I love but can't watch at the moment because he makes me think of all the things I can't do. He's been nebulizing, which is like a device. It's a device you buy on Amazon that you just put over your face, and you can put colloidal silver, or I don't know what else he's been nebulizing, saline and all sorts of other bits and bobs. And that can help the breathing if you have any asthma or any other breathing complications. Salbutamol, I don't know what you call it over there, Ventolin, can be very helpful to open up the airways. But for me, I didn't use it because I'm trying to avoid stimulants. As I've said, trying to avoid, caffeine, because I felt it affected me much more. Pseudoephedrine, things like that, because I think we need all the reserves we can to rest. And if we're taking something to falsely raise our energy levels, then that is potentially detracting from the strength of our immune response.
Yeah, I mean, let's talk about the broader things that you've tried on all the protocols and the pros and cons there. But one thing that struck me was the pain, the body aches, and I know that's not coming in lightly from someone who is a former UK Ironman champion. Triathlons are some of the most painful endurance events. How does COVID compare? I'm sure you've had colds and flus in the past. How much more painful was this than some of the other experiences that you've had in your life, whether on the athletic side or on the illness side?
How does the pain that I experienced compare to that? It was a very different kind of pain. It was very much in the insertions in my hips and in my lower back. I kind of it's kind of akin to what I think that it would like a rheumatoid arthritis would feel like, where the actual just the total inflammation, hot pain, as it were.
Yeah. Just from a takeaway best practices tips perspective, obviously it sounded like you were cautious in the weeks leading up to mid-March when you had the initial symptoms. I mean, we talked a little bit about best practice around being physically isolated, try not to prevent exposure as much as possible. But anything else beyond kind of the basic common sense around potentially masks, washing hands, etc.? At this point, would you have told yourself, Tam of 2 weeks ago, what would you have told her? Would it just been like, hey, get out of London at the end of February? Would it be, what would have been, what would you tell yourself from 2 weeks ago?
I would have told myself that I should have, isolated or myself a lot earlier. I would have told myself to go to bed early, to probably avoid drinking alcohol. And I don't drink a lot, but I would have probably cut down from my small glass of wine a night to not drinking much at all because of its effect on the liver, which is taxed, especially when you're taking all these medicines. I would have told myself to speak to less people, and to really focus on getting better and my own immunity. That would probably be it.
And then how's your daughter doing? I'm curious from your experience with your family. I mean, it seems that kids aren't as affected as much. Is that the case with your daughter? I mean, are you worried? I mean, obviously, you guys are co-isolated together. Any thoughts there?
Yeah, people have asked me this quite a lot, and from my experience and talking to different doctors, it seems that kids just are so robust with this virus. They literally get it, and I'm pretty sure that my daughter has had it. She had one night of fever and a little cough, but literally, that was it. She has that. It was nothing out of the ordinary. And that was 2 weeks ago. I think she might have even given it to me. Her dad has been quite sick. She might have been one of those people that gave me an exposure, because they're carriers, children. They run around, they go to schools. There's, they're involved with a lot of exposure. But she has been absolutely, symptom free. My au pair has been very tired. She's had sore throat. She's had muscle aches. Touch wood, she hasn't had any chest pains. And my housemate, who has also been in isolation, has had very minor symptoms too. He was allowed to get a test, and he will have a result very soon after I tested positive, because they're restricting these tests. So we will see. But, people's symptom mix, we just can't, as I said earlier, we can't predict who's going to be affected as much. Some quite unhealthy people have really bounced back very quickly from this. So, yeah. But Dr. Tommy Wood, who I spoke to before this call, who have you had him on the show yet or not?
We taped something with him, but it's gonna go live shortly.
Okay, well, Tommy's one of my favorite people, and we talk a lot, and I've learned a lot from him because he's like a metabolic genius. And his theory is that, and we should talk about this because a lot of your listeners are, I don't know, sorry, I shouldn't say that. I don't like to put people in boxes, but that it's typical of a biohacker community to be, very sort of very driven, very perfectionist, looking at your diet, all the aspects of your life, and actually that can be stressful in and of itself. And we do know that over exercise is suppressive to the immune system. There's this the curve is, too much is too much, and it can end up doing harm. And I think, and that's what's happened to me, not specifically with the amount of exercise I do now, but a history of chronic endurance exercise. So I think we need to be mindful that those individuals potentially could be more at risk from having a more moderate to severe form of this illness, because we're more likely to go back to our activities quicker. We're more likely to just push through rather than actually taking time out and resting.
Yeah, I think that's actually really spot on advice. I think this is not the time to be trying to set a new personal record. This is not the time to overexert your system. I mean, any of the energy reserve we can maintain for the immune function, we should try to reserve for that, especially if you have high likelihood of being exposed to the virus. So I think that is definitely spot on.
And I'm not making that up. There are studies that have been shown now with individuals after races, when who are developing myocarditis, which is inflammation in the heart tissue, and that is basically, you're in a really vulnerable position after any hard exercise. And I'm not talking like a 30-minute hit session in the gym. I'm talking about if you're still doing your half marathons, you're still doing your long run, you're still, if you're not replenishing after these activities, you will be more vulnerable to an infection, both in that period and also your recovery from any infection that you do get. There's been some interesting research I got sent through around, because we're all talking about supplements, immune health. How do we boost this? How do we boost that? I mean, I was a supplement, I was taking high doses of vitamin C, zinc, oregano oil, N-acetylcysteine, curcumin, fish oil. Theoretically, I had really low levels of inflammation in my body. Why have I suddenly become super inflamed? We just don't know. So listen, the supplements potentially might help, but they are in and of itself not enough. So, the lifestyle measures and measures to really calm your nervous system are very important in this, in kind of getting your immune system to come into line, rather than just chucking down a load of supplements. I think it's probably worth mentioning as well, because you know how much of a fan I am of the ketone ester, and I would literally beg, borrow, or steal to get some of them right now.
Yeah, we got. Yeah, let's talk about that after the program. We gotta send you a care package.
Thank you. Ours are all stuck somewhere, but it is interesting because Brianna texted me after she saw my Instagram video, like I told you, and she said, "Look, this is legit. These are not just um, drinks that support your performance, as a lot of people think. They have medicinal benefits of modifying this immune response, which is essentially key to preventing this cytokine storm, to preventing all the effects that I have experienced, like all this heavy joint aches, muscle fatigue, exhaustion." So I found a bottle, this morning, and I had half a bottle this morning, and it's definitely had an effect. So that's N of one morning, but I'll take anything I can get right now, and so
Yeah, it's good to hear. I think obviously very, very speculative. We don't want to, overclaim what's there, but there's definitely some interesting mechanisms of action around the anti-inflammatory modulation effects of beta hydroxybutyrate, which, as you referenced, might have some implications to the second phase of a COVID-19 presentation with ARDS and cytokine storm. So that is definitely an area of research that some clinicians and folks are looking at the very, very front line. So work to be done to prove out the mechanism, but definitely some reasonable mechanisms of why this could be helpful.
yeah, for sure. And even if you don't get the severe symptoms, a lot of people are suffering from the joint aches and pains, and some version of respiratory symptoms, which, if it can help, then all good. What really has helped as well, as I said, is like Epsom salt baths, steam showers, really getting extra magnesium into your lungs, into your body, and also that helps relaxation, because one of the things that is inhibiting our ability to recover from this virus is the stress response, the anxiety that comes with it. And in the first stages of the illness, I was getting like sweaty palms, my t-shirts were all wet, I was sweating, and which is the sign of an overactive sympathetic nervous system response. And that can have a negative effect on how well you recover. So anything you can do to kind of calm down is certainly helpful. And boring as it is sometimes, meditation, breath work, hot cold therapy, if you're well enough, really can help with this immune system regulation.
Yeah. I mean, I think that's definitely something that is going to be high priority. And I know it's a stressful time for a lot of folks. Not just, I mean, the health side is scary in of itself. And then the economic situation where I know a lot of friends, a lot of folks are being furloughed, being laid off. So it is definitely a scary time. So I don't think anyone's saying, hey, don't stress out, because there's a lot of good reason to stress out. But things I think, as you mentioned, are good personal practices to try to just at least modulate and ameliorate that stress, even though we have to be a little bit more reactionary about it than we typically would want to be. I mean, so at this point, it sounds like you're on you're through on the kind of the deepest side of it, and it looks like you're on your way to full recovery here. Anything you're special you're doing, whether on the nutrition side? Sounds like you're spending a lot of time trying to reduce stress. Anything that's been particularly helpful other than the things you've already mentioned?
Nutrition wise,
Yeah, nutrition wise.
we've all heard the stories that sugar's evil, and that we shouldn't be having sugar because it's inflammatory, etc., etc. And I think, be very mindful of any refined sugars. A lot of people are drinking too much alcohol at the moment to manage anxiety, which can have a negative impact as well. So listen, encouraging really like antioxidant rich diet, good fats, good olive. I'm craving a lot of very dense green olive oil. I like a really Greek one. I have a lot of bitters, like in lemons and limes. I have my smoothie every morning, which is frozen fruit, berries, some goat sheep whey powder, some greens powder, some grass-fed, some collagen. Sometimes I put some grass-fed butter in there, and that pretty much keeps me going, like pretty much nearly till dinner time at 6. It's quite a heavy one. I'm obsessed with, I've switched to decaf coffee, and I have collagen in my coffee. I also have hemp milk, which is basically coconut cream or coconut cream. So those kind of things I think help. It depends on your dietary preferences, because soups are very comforting, very warming. You can get things like ginger and turmeric and lots of root vegetables in there. Bone broths, if you're not vegetarian, I think I want that, even though I haven't been to the supermarket or been able to get any organic meat, but that's on the agenda, and theoretically that would be good. Manuka honey, there's some good research behind manuka honey and ginger and licorice root and all of those things. But I think try and do your best there. I think if we eat mindfully, and I think if we eat a very a colourful diet with good quality ingredients, I think that can help nourish us for sure. People are talking a lot about the microbiome and how the gut health affects how it affects your immune system. So being mindful there and avoiding things that might affect that negatively affect your gut health.
Yeah, it sounds like you're being really smart around the nutrition side. And then on the activity side, I think you had a very smart word of caution around getting too aggressive too early with fitness, with activity. But it sounds like you've been still incorporating some breath work, some of the meditation side. Is that something that you'll lightly dip your toes back into, maybe some yoga or some mobility work? How are you thinking about the activity side as you're coming through on the other side of COVID?
Yeah, I'm a big fan of a guy called Richie Bostock, who's a breath guy on Instagram, and he's been doing Instagram live sessions. And even when I wasn't able to breathe, and it almost brought me to tears, because being a type A individual and everyone else is breathing, and then I couldn't breathe, and I text Richie and said I can't breathe, and he's like, just do the meditation, and just lie, just be, listen to music. So I've been doing that. I do work with him personally as well, and I think it's been transformational in my in helping my personal journey and recovery. I've been doing some of Joe Dispenza's meditation. He's someone whom I've learned a lot from. I don't know if you know him.
Yeah, I met him at a conference a couple years back. Yeah.
And also I've been doing some light yoga, because I just I woke up this morning, I was so stiff and so achy, and part of that is the residual inflammation, and some light yoga can really help with that.
Yeah, that makes sense to get the blood flowing a little bit, get the lymph nodes and lymphatic system flowing a little bit. Sounds like it's, again, I think you're very, I think, astute on the other side. Don't, overdo it, but it sounds sensible that a little bit of breath work, a little bit of mobility work, get that lymph system flowing a little bit, just to help clear out some of the gunk as you're just, recovering. Seems like a very reasonable starting position as you're getting back into the flow of things.
And I'm a sauna addict, so being out of that lovely sauna has been difficult. So what arrived yesterday was this zip-up portable infrared sauna. I have to send you a picture. I'll put it on Instagram. I haven't put it on yet. It was really interesting, because you get in there and after half an hour you're dripping with sweat. I'm like, this is cool. But you have to be mindful then that you're losing electrolytes, blah blah blah. So
Yeah. Well, again, thanks so much for walking this. Yeah, no, this is super helpful, and I think we'll get this out as soon as possible, given the timeliness of this information. So, Zil, we're going to be popping this to the front of the queue here. So, for folks that want to follow along Tam's journey and recovery and her updates here, I know you're getting back active on social. So you're at Sporty Doc, right? SPORTIEDOC. Anywhere else that people should stay tuned and follow along?
I think I can only manage one social media outlet at the moment, so I'll try with Instagram.
All right, so follow Tam on Instagram, Sporty Doc. Hope you have a great weekend here, and we'll talk soon. Thanks so much, Tam.
To you guys, lots of love, stay well.
Thank you so much for listening to this week's episode of the HVMN podcast. If you're interested to learn more about HVMN and our offerings, visit hvmn.com/pod. If you're tuning in on audio platforms like Apple Podcasts or Spotify, we'd super appreciate an honest review. Please remember to subscribe, and if you're watching this on YouTube, please give this video a like, and remember to hit that bell to get notified whenever we post. We also have a dedicated Discord server, which you can join by first taking a short survey, and then I'll personally send you an invite to join the community there. The link to that survey will be in the description, along with any other relevant links. We appreciate your continued support, and we'll see you all next week.